Sustainable Development Goals. Goal 6. Clean water and sanitation. Targets. 6.1. By 2030, achieve universal and equitable access to safe and affordable drinking water for all. 6.2. By 2030, achieve access to adequate and equitable sanitation and hygiene for all and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. 6.3. By 2030, improve water quality by reducing pollution, eliminating dumping and minimizing release of hazardous chemicals and materials, having the proportion of untreated wastewater and substantially increasing recycling and safe reuse globally. 6.4. By 2030, substantially increase water use efficiency across all sectors and ensure sustainable withdrawals and supply of fresh water, to address water scarcity and substantially reduce the number of people suffering from water scarcity. 6.5. By 2030, implement integrated water resources management at all levels, including through transboundary cooperation as appropriate. 6.6. By 2020, protect and restore water-related ecosystems, including mountains, forests, wetlands, rivers, aquifers, and lakes. 6.A. By 2030, expand international cooperation and capacity building support to developing countries, including water harvesting, desalination, water efficiency, wastewater treatment, recycling and reuse technologies. 6.B. Support and strengthen the participation of local communities in improving water and sanitation management. COVID-19 response. Availability and access to water, sanitation and hygiene, WASH, services is fundamental to fighting the virus and preserving the health and well-being of millions. COVID-19 will not be stopped without access to safe water for people living in vulnerability, UN experts said. The impacts of COVID-19 could be considerably higher on the urban poor living in slums, who don't have access to clean water. UN Habitat is working with partners to facilitate access to running water and hand-washing in informal settlements. UNICEF is urgently appealing for funding and support to reach more girls and boys with basic water, sanitation and hygiene facilities, especially those children who are cut off from safe water because they live in remote areas, or in places where water is untreated or polluted, or because they are without a home, living in a slum or on the street. In response to the COVID-19 outbreak, the International Organization for Migration, IOM, is adjusting its WASH services to prevent the spread of the disease. This includes continued support to affected, at-risk, low-capacity and fragile countries, to secure WASH services and infection prevention control in health facilities.